I thought that the first question that people sent in was actually an excellent one, is what can you do with if you have MCAS, and which is mast cell activation syndrome, and long COVID, whether you had it pre-existing or whether it appeared as a symptom of long COVID.
Yeah, so I'd like to give a quick synopsis of what MCAS is, Mast Cell Activation Syndrome. This could be an entire webinar, and it should be of its own. So I'm going to talk about it briefly right here. So for those of you who don't know what mast cell activation syndrome is, it's when your mast cells, which are your oldest immune cell of your body, become hypersensitive. So normally mast cells should, normally they trigger histamine and a repertoire of 1,000 other chemicals when we have a sensitivity or an allergy to something. And that should be a transient effect. So just say someone's allergic to a cat, they visit a friend's house, they get itchy eyes, runny nose, they go back home, and those symptoms go away. That was an appropriate transient inflammatory reaction of the mast cells. Now, for most of our patients, they're having their mast cells triggered constantly. They're stuck in this loop of immune dysregulation. Mast cells exist in many different parts of our body. They line our nerves. They are in our gastrointestinal tract. They're in the brain. They're in the bones, not just the skin, not just the eyes. So our patients will have symptoms in all of these different areas that I mentioned. So that's mast cell activation in a nutshell. So the question was about how do we deal with mast cell activation syndrome? Well, the first thing I want you to know is that mast cell activation syndrome is a secondary illness. It's caused by triggers. It's not just, oh, I have that as a primary cause. Absolutely not. There's drivers to that. So those drivers are usually a combination of infections, toxins, stress, could be structural integrity issues, all of these things causing inflammation, which then tip off your genes to express, and then mast cells become highly activated. They become aggravated because the body keeps thinking it has something to defend. So how do we go about treating this? The first thing I do is, well, I think of it as putting Band-Aids actually on the immune system at first, because I know that I've got to remove the triggers at some point. I'm going to, but if I try to remove the triggers, that can further exacerbate the mast cells. So the question is how do we handle mast cells when we have something like long COVID or other infections going on? Usually it's the infections or other insults of the system that are one cause of long COVID for sure. So like I said, I want to modulate the immune system. So I will be using peptides. That was part of the question. So peptides like KPV, Lexinox help to modulate mast cells for sure. T4 frag can do that. I'm also liking to add in certain medications like ketotifen and cromolyn. The ketotifen will stabilize the mast cells. There's a lot more that needs to be done individually for each person, also to understand why this is being triggered constantly, but that's a good first step.
Yeah, and just to emphasize, because the person who asked the question, that's why I figured you'd do a good one in answering it, was really looking for what we can do other than the antihistamines and mast cell stabilizers, because that is what generally is done for mast cell activation. And that's where the peptides are a newer addition to the repertoire that Dr. Parpia has been using for quite a while with really good results. I mean, I think that's what people have to see, because the antihistamines, though amazing for some people, often have a lot of side effects,
right,
and that are unpleasant in themselves.
Right. So, I used to use more antihistamines, but now really I will use ketotifen, which is a medication from the compounding pharmacy, and cromolyn from the compounding pharmacy. It's pure. There's no additives, no fillers, no colors. My patients are not rejecting those things. And I had to use other antihistamines instead, but not anymore. I can replace them with peptides. Now, there are some patients, they're few and far between, but there are some who can't even tolerate the peptides. You might be one of them. they need to be done very, very carefully and at low doses. I wouldn't recommend just grabbing the peptides and starting them, just like with any medication or any supplement. It's got to be under the watch of somebody who's experienced in using them.
Yeah. And often we also, and this is another place where low dose naltrexone can be helpful, because it's basically mast cell activation. In fact, when long COVID was first being discussed, I mean, it was really early on, even in 2020, by the summer, when it was realizing that people were having problems, long after the acute symptoms were gone, there was a lot of doctors, no, I shouldn't say a lot, there were a handful of doctors who were realizing that there was an aspect of mast cell activation going on. In fact, some of them thought that was the whole story. So there's been a lot of experience amongst doctors who are willing to try things using mast cell stabilizing medications. And what's always so interesting in this world is really when it comes down to it, we're just trying to quiet down the overactive immune response for almost everything. And that's why many different things will work, like LDN, which is another way to quiet down the immune system and help normalize its response. So people often don't think of it directly as a mast cell stabilizer, because it's not. It really is working more on other parts of the innate immune system called toll receptors and other parts. But because the system is a system and everything talks to everything, anything you can do to quiet things down will be helpful. So that's not the whole mast cell story, but that's a little piece of it.